Now, in the wake of the pandemic, Centers for Disease Control Director Dr. Rochelle Walensky is ordering a shakeup for the agency.
A review pointed to several missteps in how it handled the response to the COVID-19 pandemic. CBS News' Zinnia Maldonado joins us with the changes we can expect from the CDC moving forward. Zinnia.
Chris and Mary, this external review follows ongoing criticism of the CDC's response to the pandemic since March of 2020. The CDC says changes are intended to make the organization more nimble and fast-acting when it comes to public health threats. COVID-19 took the lives of more than 1 million people in the U.S., and the head of the CDC, Dr. Rochelle Walensky, says the country's public health infrastructure was not up to the task of handling the pandemic.
We learned some hard lessons over the last 3 years, and as part of that, it's my responsibility, it's the agency's responsibility to learn from those lessons and do better.
In April, Walensky ordered a review of the CDC's pandemic response. The report says the organization had become too rigid and bureaucratic to act quickly when needed to, specifically citing its analysis of data, the sluggish release of information to the public, and its confusing and overwhelming COVID guidance.
Data dashboards that really give you a sense of what's happening, where you live, in real time. That was not available, and that was something that many of us were asking for.
Public health experts say changes following the report are a step in the right direction as the U.S. works to contain another major public health crisis, monkeypox. Cases in the U.S. now surpassing 13,500.
Acknowledging the weaknesses, acknowledging that not everything went right, really does pave the way for people at the CDC as well as more broadly to change direction, to correct course, and to do better in the future.
There's always going to be the next disaster, the next emergency that's going to take place. And so we've seen how important the CDC is to the public's health.
Walensky says the reset will be focused on healthcare equity and getting information to the public more rapidly, adding these changes are a CDC initiative and were not directed by the White House. Walensky says changes also include internal staffing moves, improving capabilities in the lab, and steps to speed up the release of crucial health data. Mary.
Zinnia Maldonado. Zinnia, thank you.